I want to most sincerely thank the All African Students Union for inviting Shiza to this really critical and important summit. Just for context, Shiza is a global organization that has presence in 21 countries in 6 regions. We fight for a world where every girl chooses her own future. We believe that every girl, no matter where she is born, deserves the right to be educated, respected, and heard. And to this end, we find, fund, and support solutions that not only educate girls and empower girls, but also strengthen the communities where those girls are able to flourish. So based on our work with our partners working with and for girls, I will limit my submissions to these issues, specifically to adolescent girls and women, respectively. As we all know, and we've had, in today's sessions and yesterday as well, and we're very familiar with the fact that education has been particularly hard hit by the COVID-19 pandemic. According to the African Union International Center for Girls and Women Education in Africa, in April of this year, the school closures on the continent alone translated to 20 million learners out of school at pre-primary level, 160 million at primary level, 56 million at secondary, and 8 million at tertiary level. Across the continent, challenges with irregular electricity, unreliable and unavailable internet connectivity, and poverty further propound the problem of alternative pathways to learning, resulting in many students, particularly girls, having no access to continued learning during the pendency of the pandemic. It is really important to mention that prior to the COVID-19 pandemic, a 2016 UNESCO report estimated that 52 million African girls were already out of school. The 76 million women who were sampled in 9 African countries were also found to be illiterate. And the underpinning reasons for this can be attributed to systematic harmful values and norms of patriarchy, harmful traditional practices, religious and social economic pressures, as well as gender-based violence, amongst others. As regards child marriage in particular, Africa is home to 15 of the 20 countries with the highest rates of child marriage in the world. To put this into perspective, every 2 seconds, a girl is married before she is physically or emotionally mature enough to become a mother or a wife. This translates to 15 million child brides globally. Drawing from data from the Ebola outbreak, the Malala Fund in their 2020 report, Girls, Education and COVID, estimates that a further 20 to 23 million more secondary school going aged girls from the global south especially will be out of school following the crisis. Over the last 9 months, women's unpaid care work has increased exponentially as a result of school closures and the increased need to care for elderly and sick relatives. Girls have reported being too tired to take on reading after a day of chores, and we have all heard the alarming reports of the increase in teenage pregnancy, sexual and gender-based violence, as well as an increase in FGM, which is a precursor to forced and early marriage in most of our communities. It's really important to note that 60% of women the world over work in the informal sector. And with failing markets, millions of women are at an even greater risk of further falling into poverty. So what can we do to tackle these challenges and ensure girls are not denied their fundamental rights to an education? We offer the following. Firstly, involve girls in recovery processes. Talk to girls. Listen to girls. Program and design and implement with and for girls. Girls are the experts of what they need, and their contributions should not be negated. There will be much higher chances of success rates recorded if practitioners could use a girl-centered approach, for example, when onboarding girls back to school. Girls' voices, concerns, and needs should be included and must be reflected at national and local strategies. Secondly, remove all barriers that will hinder girls from resuming their studies. Policies across the continent to keep girls in school and back to school, even if they fall pregnant, are needed now more than ever to avoid catastrophic fallbacks from the hard-won gains in girls' access to education. The decision by the Economic Community of West African States Court, the ECOWAS Court, that ordered Sierra Leone to establish national-wide programs to help pregnant and nursing girls return to school after the Ebola outbreak should be used as persuasive precedents in all African Union states. Thirdly, governments, funders, and development agencies must continue to prioritize education in addition to health to ensure that there is available funding for the sector once normalcy returns to mitigate some of the eminent challenges that girls are likely to bear the brunt of. Fourthly, leverage the power of grassroots organizing. Grassroots organizations are the most effective in reaching the most vulnerable and underserved girls in any community. In close collaboration with education and health officials, they would be the most instrumental in ascertaining girls' safety in community and supporting efforts to reintegrate all girls back to school, including those who previously may not have been enrolled in school prior to the pandemic. And finally, we must all denounce all forms of gender and sexual-based violence. Perpetrators of violence of gender and sexual abuse must be brought to book expeditiously and judiciously. Girls and women should not be made blameworthy and should most certainly not be discriminated as a result of such atrocities, which are often fathered through unwritten customs, cultures, and practices. We must address the inequalities of the digital divide, remedial classes, and other strategies to bring girls to speed who are unable to learn for the last 9 to 10 months due to technology should be prioritized to ensure equity in the classroom and learning curve once normalcy resumes. Thank you once again for inviting us to this important conversation and for your time.